gasoline-powered vehicles, lawn equipment, recreational equipment, area sources in the gray there are dispersed sources such as auto body shops, dry cleaners. And then I also want to point out with this pie chart is that although there are opportunities for improvement in this sector, point sources or industrial manufacturing are not the major sources of volatile organic compound. Most of the sources are dispersed. And on that note, I'm going to hand it over to Jenny to go into some of the results in further depth.
Thank you, Chair Gordon and council members. Patrick had mentioned something called health benchmarks. Because there are no defined standards for air toxics, such as the VOCs that we analyzed in this study, we use health benchmarks to characterize the risk of exposure. A health benchmark is the concentration of a chemical that is likely to pose little or no risk to human health. The further you go beyond the health benchmark, the greater the potential health risk. Health benchmarks are very conservative values. They're designed to protect vulnerable subpopulations, such as infants, children, and the elderly. For this study, we selected chronic or long-term benchmarks defined by the Minnesota Department of Health as screening values because they are the lowest, most conservative levels for comparison. This chart here shows the results that we found over health benchmarks. There are 5 VOCs that were found to be over their health benchmark in at least one sample. The number of samples that are found over their health benchmark is out of a total of 900 samples. The 5 VOCs were benzene, formaldehyde, naphthalene, tetrachloroethylene, also known as PERC, and trichloroethylene, also known as TCE. Out of 900 total samples, except for formaldehyde, which had a fewer number of samples at 114 total, although every detect result for formaldehyde was found to be above its health benchmark. This map shows all of the sampling locations throughout the entire study, as well as the results over health benchmarks. I'd like to note that the size of the dot corresponds with the level found in that sample and is not a geographic spread or reach. Sample locations with no results over the health benchmark are indicated with a small gray point. Formaldehyde is not shown on this map due to the varied sampling approach that we took for formaldehyde. Over the next 5 slides, I'm going to go over the results of the 5 VOCs that were found to be over their health benchmark. The average noted for each of these VOCs is the average across all detect levels. For benzene, we found 78 results above the health benchmark, with an average of 0.7 micrograms per meter cubed. The results for benzene are likely associated with traffic use in Minneapolis. Benzene is a fuel additive, and one of the main sources of benzene emissions in Minneapolis is from mobile sources. Mobile sources are both on-road and non-road, which includes construction equipment. The results confirm that in addition to fine particulates, benzene is a health concern related to intensive traffic use in Minneapolis, and it can likely impact health at a further distance from roadways and heavier fine particulates. Benzene is a known carcinogen, and long-term exposure to high levels of benzene in the air can cause leukemia.
So does it look like the benzene is higher at busy intersections or along freeways, or if it's associated with traffic? And maybe you haven't looked that closely. I'm trying to enlarge the map and see where these is there anything similar about the largest concentrations?
Chair Gordon, that is something that we will likely be able to see in further fine detail when we complete the land use regression. The land use regression will take into consideration all of the different land uses, such as major roadways, and it will extrapolate the data from the known sources that we have. And benzene is a good example of a VOC that will show up better in the land use regression.
Okay, look forward to that. Thanks.
Tetrachloroethylene, also known as PERC, we found 100 times over its health benchmark. 29 of those 100 were collected outside of a dry cleaning facility. The average level of PERC across the city was 1.1 micrograms per meter cubed, which does not include the results from the samples taken outside the dry cleaning facility. The average outside of the dry cleaning facility was 176.8 micrograms per meter cubed, well above the health benchmark of 2 micrograms per meter cubed for PERC. During each sampling event, we placed 2 to 4 canisters on the roof of a dry cleaning facility in Powderhorn. We chose to look at the dry cleaning results separately since the data inflated averages across the city, although we would assume similar levels at other dry cleaning facilities in Minneapolis that also still use PERC. These results show potential concern for both levels across the city and at dry cleaning facilities. PERC is primarily emitted to the air through its use as a solvent in dry cleaning facilities, although it is also used in auto shops and home products, such as this brake and parts cleaner. Tetrachloroethylene is a likely human carcinogen and may cause kidney and liver damage. Trichloroethylene, or TCE, was found 14 times above its health benchmark with an average of 0.3 micrograms per meter cubed. PERC would take further study to identify more specific sources and reasons for its distribution within the study. TCE is a solvent and is used in industrial processes, automotive shops, dry cleaners, and is also found in home products. TCE is a known carcinogen. There's strong evidence it can cause kidney cancer in people, and some evidence it may cause liver cancer and malignant lymphoma. Naphthalene was found 8 times over its health benchmark with an average of 0.8 micrograms per meter cubed. Combustion is the largest emission source of naphthalene, and there is some evidence that there may be increases of naphthalene in areas with older vehicles without properly functioning catalytic converters, as well as in areas with high diesel traffic. Naphthalene is also the main ingredient in mothballs. More sampling, modeling, and/or combination of these would need to be done to understand a distribution of naphthalene and its sources throughout the city. Naphthalene is a possible human carcinogen. Exposure to naphthalene is associated with other health effects, such as a particular type of anemia, liver damage, and cataracts. Formaldehyde was detected in 93 out of 114 samples, and all of those 93 detects were above the health benchmark. The average level of formaldehyde was 3.6 micrograms per meter cubed. Formaldehyde was the only VOC that had an average level above its health benchmark. Formaldehyde samples were located at transects across roadways in an attempt to determine differences away from the roadway. Formaldehyde was detected at all sample locations. Results were similar at each sampling point, which indicates consistent levels of formaldehyde across Minneapolis that are higher than the health benchmark. These results are likely associated with traffic use in Minneapolis. Formaldehyde is a byproduct of combustion, and mobile sources are the main source of its emissions in Minneapolis. Similar to benzene, formaldehyde is another health impact of traffic and may also impact health at a further distance from roadways than heavier fine particulates. Formaldehyde is a known carcinogen, with some studies suggesting that it is associated with a variety of certain cancers, including leukemia.
So we have a couple questions, I think, maybe about that slide.
Sure.
Councilmember Bender?
I think we all just have the question of why is there such a pronounced line there across, I think it's 38th Street? Is that because of how it was measured, or is there some sort of pattern on that roadway?
Councilmember Bender, this slide for the formaldehyde, it looks different than the other maps. All of the location points that you see, those are all of the sampling points. Because the results were so similar at each sampling point, it kind of makes the map a little more difficult to interpret. So this map here just shows the sampling points of formaldehyde. It doesn't show the actual results. They're the levels that were at each sampling point. However, the levels at each sampling point were very similar. There were really no outliers. The maximum was only 8.5 micrograms per meter cubed, so not much above the average. There weren't really many outliers. So we didn't sample across the entire city. We just sampled at those 2 main transects.
So why did you choose 38th?
That would be a question for Jim Doughton, Chair
Okay.
Gordon. He selected the locations
Okay.
for those. He selected those locations, I believe, based on trying to find a transect across a major roadway. So in this case, we crossed 35W as well as Hiawatha, although the selection of 38th, as opposed to going north or south of there, I'm not sure of his technical decision in that.
It seems like it wouldn't be that bizarre then to assume we would have a similar measurements at 42nd or 46th or Lake Street or Franklin or any similarly used roadway.
Chair Gordon, we believe that to be true. We would anticipate similar results across the city, and formaldehyde should be another VOC that will benefit from the land use regression, which is where we'll statistically be able to see if there are differences away from the roadways.
Thank you. I think that answered all the questions. So you can go to the next slide.
So in conclusion, the average results across the study confirm that air in Minneapolis is relatively good across the entire city. Hundreds of samples came back with few or no chemicals of concern. However, there were many samples that had chemicals over health benchmarks. Some of these results were expected, such as benzene and formaldehyde, that come primarily from transportation sources. However, there were also elevated levels of chemicals like tetrachloroethylene, primarily found in dry cleaning operations, but observed in samples taken across the entire city. While much of the study showed how clean the air is in Minneapolis, there were also results that are of potential concern to public health. For more information about our presentation, we have written 3 supporting documents. There is the executive summary for a brief overview and 2 more detailed reports, the short and the long report, which are all available on our webpage.
All right, and so now that the study is done and we've talked about some of these, what are the next steps and what can we do with the data that we have? One obvious way is to continue with the Green Business Program work. This picture that you see here is an example of an elite dry cleaner who switched away from PERC this year. While we can look at the study averages across the city and possibly say that the problem isn't significant, when you look at individual locations like this where a residential home has a wall adjoining to one of the sources, we've found levels as high as 1,000 micrograms outside of dry cleaners. And so for this particular area, it was an issue and it no longer is an issue because we can drive towards solutions with the Green Business Cost Share Program. Right now, as I'm speaking, actually, I'm missing a meeting with our partners at Clean Air Minnesota, and we gave this presentation to them 3 weeks ago. And the Pollution Control Agency, Environmental Initiative, Minnesota Safety Council, and other folks that are in that group are sitting down to figure out ways that they can assist Minneapolis in this work, in this green business work, and switching over more of these dry cleaners. We have 5 left here in Minneapolis. But maybe more importantly is driving a larger statewide program to eliminate PERC and what can be done there. That conversation is taking place as a direct result of this study. More focused sampling, we talked a little bit about formaldehyde, doing some more additional focusing around either dry cleaning facilities, automotive shops, other sources. So instead of focusing on a citywide sampling program, focusing on specific areas where we picked up different hits and different chemicals. And then Jenny also mentioned the land use regression model through Virginia Tech that she's organizing. That will allow us to extrapolate some of this data across the city and try to figure out what results we might have in areas where we didn't do sampling. And as you mentioned, what it might be at different roadways and different intersections based on the information that we already have. And then one clear message of this study is that we need cleaner transportation options. Whether it be cleaner vehicles, a more bike-friendly city, and there are definitely things that Minneapolis is doing, and those efforts need to continue because we can see that the people in Minneapolis who actually use vehicles the least are exposed to, I was just reading the 2017 Minnesota Pollution Control Agency report, are exposed to some of the highest levels of pollutants while we're driving the least. And so we need to continue those efforts here and elsewhere with our own fleets, and then also in transportation that's happening at private sector and then in the public. I want to say thank you to our study partners. I won't read through all of them, but just to make sure that they're formally listed here. It would not have been possible without all of these partners to help us out, and again, those volunteers. And for more information on this study, you can link to, there's data in Tableau, and this is the link to it where you can look at the individual results that we got for the different chemicals, and you can play around with that data yourselves. And then a link to our web pages there. I want to say thank you for your time and listening to us today. We're grateful to be able to have the resources to do this cutting edge work. This work is not going on in other cities, and that's a result of the resources that you allow us to utilize to make this kind of study possible. So thank you very much.
Thank you. Councilmember Fry has a question. And Councilmember Khan.
Thank you, Mr. Chair. First off, thank you for the presentation. I think it was very informative. There was a slide right at the very beginning showing emissions in different parts of the city. Yeah, you just passed it, I think. One more. I think one more. In Camden, there's a larger red dot with like kind of a bullseye there. What does that mean?
Councilmember Fry, the larger dots correspond with a larger amount found in that sample. When you see the bullseye, that means that there was more than one result that contained benzene at that location. On a static map, such as these that are in the presentation, it's more difficult to interpret. But if you go to that Tableau website, you can actually select that individual point, and you can get every single result that was found at that point.
Thank you. Is there other particulate matter that could potentially influence a person's health that we weren't studying? I guess I'm a little bit surprised to see that there isn't very much. Well, at least we don't have too much data along the east side of the river and further northeast, which is, I believe, the area that gets the most complaints in the city regarding air quality. So just across the river from northeast, you have a combination of GAF and Northern Metals and several other industrial plants.
Yes, Chair Gordon, Councilmember Fry. Yes, this study focused specifically on volatile organic compounds. And so it is possible that there are fine particulate pollutants in those areas, but we didn't examine those in this study. And we really look at the hits that we got with these canisters. We used a chronic health benchmark when we analyzed or did analysis on the samples. And we look at that as a screening tool to see if there may be problems that we should look into further. We don't believe that this study gives us a comprehensive view of air quality in Minneapolis. It gives us a unique view, unique snapshots into air quality where we work, play, and live that really hasn't been done before, but it doesn't give us an overall picture of air quality in Minneapolis.
Okay, that's helpful. And then the last question, you mentioned, I believe it was land regression model that they did at Virginia Tech. I was just wondering if you could explain what that is.
Chair Gordon, Councilmember Fry, the land use regression model, it's a modeling technique, and it takes into play all of the results that we already have, and it extrapolates that data to areas where we don't have results. So if you look at the map that I've put up there right now, and to kind of piggyback on your previous question, if you're looking at an area and you're wondering why there's a blank area, there's an area, geographic area that doesn't have any points, it's possible that we just didn't sample in that area. So this map that's up there right now, all of the smallest gray dots are the locations where we sampled where there were no results over health benchmarks. But this map shows every location that we did sample at. So if you're looking at an area and it seems like a large blank area, it's because we didn't sample there. Now going back to the land use regression, what the land use regression will do is it will fill in this map right here. So it will extrapolate the data that we have over all of Minneapolis. And when a land use regression is performed, they're usually done over a larger geographic area, such as multiple states, and they might have 120 sampling locations across multiple states. We have 120 sampling locations across the city of Minneapolis. So for those VOCs that we had enough results to run the land use regression model, it'll be a very accurate descriptive model.
Thank you. I especially appreciated the work that you guys did with the canisters. I think that really highlights some of the improvements that we need to make, and I'm sure it took a heck of a lot of work. Thanks.
Councilmember Connell.
Thank you, Mr. Chair. So is there a portion of Is there a section in these results where you have some interpretive analysis of the data that has been presented today, where you make some recommendations about what we can do to address some of these issues that we're seeing pop up on the maps?
Chair Gordon and Councilmember Cano. In the long report, we do get into more detail within each community and the results that we found within each community. We break them out to look at that data in more detailed ways. We do also get into some recommendations, areas where we know each of these VOCs, their sources, the multiple sources that they come from. Some are obvious. Transportation is a major issue. Some like tetrachloroethylene, where we're looking at a specific dry cleaner. That's one thing. We're looking at TCE, naphthalene. Those VOCs are a little more difficult to point a source to and to determine an exact cause and thus a solution for. But we do get into some of those analyses in the long report.
Okay. And what has been the conversation at the staff level about these findings and the intersection between the data points that we see here on these maps and a racial equity analysis coupled with a cumulative impact health analysis? If you could share a little bit about how you guys are looking at that.
Sure. I think Chair Gordon, Councilmember Cano, I think that we're hoping that the land use regression will help us look at the data in just that way. When we started this study, I think we were hoping there would be we thought that there might be a clear picture of inequity in some of the data that we were gathering. I think when we got to the end of the study, we found that it just wasn't enough samplers to draw that kind of conclusion, and that's when we started to look at the Virginia Tech in doing the land use regression model, where we could model out the data and see if some of those pictures become more clear with this data.
The cumulative health impact, what about that component of it, which makes the cumulative health impact conversation acknowledges that while there may be lots of different kinds of challenges throughout our city with some of these identified pollutants, there are certain areas of our city that are already overburdened with other pollutants, whether they be socioeconomic or stem from institutional racism or historic environmental racism issues. So what's kind of how are you applying that layer to this map?
Chair Gordon and Councilmember Cano. One of the ways that we're looking at cumulative health impacts, or one of the approaches that we took in this study that will address that, is by making comparisons to the chronic health benchmarks that I mentioned earlier. Those are very, very, very low conservative levels. If we looked at acute health benchmarks, we found no results over a health benchmark indicating no immediate threat. So if we're looking at cumulative effects, while we can't necessarily say that your exposure to tetrachloroethylene combined with your exposure to fine particulates and something else is going to have this effect, we know the effects of tetrachloroethylene. By looking at those very low, very conservative chronic health benchmarks, we're already setting the bar very high for what we're looking at and for our evaluation of these chemicals across the city.
Chair Gordon, Councilmember Cano, if I may piggyback on that, is that we've working with the Minnesota Pollution Control Agency when we put this study together, and you talked about the different layers that contribute to pollution in a neighborhood and the different burdens, layers of burden. Well, this land use regression may be helpful in providing more information when looking at cumulative impacts is another layer of information that we have when making decisions.
Okay. I'll look at the report further online. Thank you.
I also think it'll be really important that this information gets shared with the Sustainability Office and with the wider health departments, and I'm sure that it will feed into a lot of other work that's going on in the city. I just wanted to ask a little bit about this, the land use when we dig down more in depth. When will that information be available to us and to the public?
Chair Gordon, the land use regression is in the works right now, and it should be completed this spring of 2017. So in a few months, we should have those maps.
Okay, wonderful. Also, I noticed when I went to the Minneapolis air quality website, it was really easy to find the executive summary and the short report, but I'm not sure there's a link up for the long report yet. So maybe when you get that link and when it's live, you can also email it to committee members so it's easier for us to access, because it takes a little digging down, and then we can also share that with our constituents easily.
Absolutely.
Okay, thank you. And Councilmember Glidden also has a comment or question.
Thanks, Mr. Chair. So in the findings, you refer kind of generally to transportation, and I guess that you're kind of referring more to just the fact that we're got a lot of vehicles across the city, and and it contributes in kind of more this even-handed way, or I guess I'm trying to understand that, but I'm curious when you do this land regression if there's any special look at freeways and freeway entrances and exits as points of pollution where there might be more of an impact. And I just have a particular interest in this. Of course, many wards are crossed by freeways, entrances, and exits, but maybe you could speak to that a little bit.
Chair Gordon and Councilmember Glidden. Yes, the land use regression will take into consideration the different types of roadways, so the type of traffic on it, so 35W versus Hiawatha versus Park Avenue, and the level of traffic, as well as entrances, exits, areas of congestion, intersections that are congested, things like that.
And will this have are there recommendations then for us to develop after we get better data, or will this also include some recommendations?
Chair Gordon, Councilmember Glidden, the report itself doesn't lay out specific recommendations. It generally states directions. So in transportation, that this shows another layer of data that supports cleaner transportation.
All right, thank you.
I suppose another thing for us to think about is how this might relate or feed into the comp plan work that's going on too. Like, this is good information, hopefully, that will be carried through and forward. I'm assuming that it is. Appreciate that. I don't see any other questions or comments, so thank you for your presentation. And I'll move to receive and file this work. All those in favor say aye.
Aye.
Any opposed? That carries then. And before we adjourn, I have to go back to item number 8. I moved staff direction and to receive and file, but we actually also have to authorize an agreement on the contract that we were discussing. So I will move to authorize the contract with Pillsbury United as described. All those in favor say aye.
Aye.
Any opposed? That motion carries then, and I'll just double check. We've covered everything now. All right, thank you so much. Thank you, everybody. This meeting is adjourned.